So, good afternoon, everyone. I hope you're having a great time. Today I will give an exciting lecture about carboxy therapy. During carboxy therapy, medical carbon dioxide gets injected directly into the soft tissues to achieve body contouring, and I will share with you several discoveries that I made. One question for the audience, please. Who has experience with carboxy therapy? Just a few hands. Okay, thanks. So here we're going to look at the short video. And yeah, here you see I'm injecting medical carbon dioxide gas in between the muscle bellies of the rectus abdominis, and here I'm actually creating the midline. So it's a rather safe procedure. It takes about 5 to 10 minutes, and the results can be amazing. So to understand carboxy therapy, we briefly go back to medical school. So Christian Bohr from Copenhagen was the first to describe the Bohr effect. So let's have a look. During carboxy therapy, medical CO2 gets injected into the soft tissues. Consequently, the hemoglobin has less affinity for oxygen. So oxygen gets released into the soft tissues and fibroblasts get activated. This results in local shrinking of the soft tissues and also, to a certain extent, loss of interstitial fluid. So during carboxy therapy, there's sort of an abnormal state because the CO2 concentration is higher than it is under normal circumstances. This results in hyperoxygenation of the soft tissues. This is sort of like a low-grade infect for the body, and the fibroblast and myofibroblasts get stimulated. So consequently there follows a remodeling of collagen. So carboxy therapy works all the way from the skin, the complete fibroseptal network, superficial facial system, as well as the muscle fascia, so the complete soft tissues get treated. So carboxy therapy has been around for a long time. What's new is what I like to call carbo sculpting, so high definition body contouring with CO2 gas. So now we're going to look at the roadmap for carboxy therapy. So if I want to create the midline, I inject in a vertical manner in between the rectus abdominis as seen on the picture. If I want to create the semilunaris line, I inject along the line. The same goes for the horizontal part of the rectus abdominis. I can create a deeper, better visibility of the lower part of the pectoralis major. I can even inject in between the muscle bellies from the triceps. Also, so the in between the deltoid and the triceps. So if there's locally tighter skin and to a certain extent loss, so due to lipolytic effect, less fat. If there's a small concavity in between the muscle bellies afterwards, the muscle bellies will appear larger. So this patient, she gained 36 kilos during her pregnancy. She came to me for loose skin, especially on her lower abdomen. I was able to pull out the skin about 10 to 12 centimeters, and this was the result after 6 treatments. So this was kind of a surprise for myself and her. So please bear in mind, she came for loose skin, and she actually wrote me a text saying that saying carboxy therapy is amazing, look at my abs. Most likely the increased visibility from the abs is also due to increased production of extracellular matrix, so in layman term, increased production of hyaluronic acid. If you look closely above the umbilicus, there's skin redundancy, and after 6 treatments, there's actually a concavity and a very deep midline between the abs. Question I get asked oftentimes is how long do the results last? Well, this is 8 months after her last treatment, so quite a stable result. I have to say she does Olympic weightlifting. So the next patient, 36 years old, we're going to look at the result after 4 treatment sessions in 3 weeks. Let's have a look. So here also we can see deep midline, and in the semilunaris even the triangular spaces are visible, and in total the abs look more bulky. So the next result is impressive. Let's have a look. So here, this is the result after 4 treatment sessions, 2 weeks apart. You can even see the subpectoral triangle, semilunaris, and real visibility of the serratus anterior latissimus dorsi. So carboxy therapy is as if a vacuum cleaner gets applied underneath the skin. So if you go on vacation to, let's say, Miami, Mallorca, Ibiza, you want to have a nice beach body, plan 4 treatment sessions in 2 weeks' time. So look at the insertio of the latissimus dorsi, impressive results. So in the same treatment, I can treat the anterior part and also the posterior part of the torso. So here you can see it's quite a wide back. However, there are no real, muscle bellies are not clearly visible. So with the correct treatment, I can sculpt the erector spinae, also create a vacuum in the fascia thoraco-dorsalis, so the rhomboid shape, and also increase the visibility of the inferior part of the latissimus dorsi. So now I'm going to talk about my vision for the future. So there is a limit to where high definition liposuction is considered safe. Some fat has to remain between the skin and the muscle fascia. If the liposuction is too radical, there's a higher risk for the formation of xaroma, damage to the subdermal plexus, and also the formation of fibrosis. So to further increase the outcome and to go more towards extreme body contouring, I would say it's a good strategy to combine high definition liposuction with, let's say, energy-based devices like Vaser for liquefaction of the fat, consequent removal, better preservation of the fibril septal network, and on top perform several sessions of body contouring to create deeper lines and further increase the outcome and go more towards extreme body contouring in a safe manner. So thank you very much for your attention. If you have questions,